I was tagged a lot in this video by Dr. Shannon Clark, an OBGYN, and I had to talk about it because it's the perfect example of how unethical practices can be built into medicine under the guise of training. In it, she shares a story from the 90s when she was a third-year medical student on her OBGYN rotation. One day, she was in the operating room watching the delivery of a Black woman alongside the faculty physician and a resident. After the baby was delivered, the faculty member turned to the resident and asked them if they'd ever repaired what's called a 4th-degree laceration. That's the most severe type of vaginal tear that can happen during childbirth. It extends through the vaginal tissue, through the perineal muscles, and into the rectum, and it requires surgical repair. Well, the resident said, "No, I've never repaired one before." Because this patient didn't have a 4th-degree laceration, the faculty member took a pair of scissors, put one side of the blade into the vagina, the other side of the blade into the rectum, and cut a 4th-degree laceration, just so the resident could practice. I wish I could say I'm surprised, but the truth is that's not an isolated story. For decades, doctors have been trained to practice invasive exams like pelvic and rectal exams on unconscious patients without their knowledge or consent. A small 2003 JAMA study revealed that nearly 90% of medical students at one medical institution had practiced pelvic exams on women that were anesthetized without their explicit consent. And in 2022, a study found that nearly 67% of medical students that did an exam under anesthesia never witnessed explicit consent being taken for a medical student performing that exam. Thankfully, in 2024, guidance was sent from HHS requiring consent for exams like rectal, breast, pelvic, or prostate exams that are just for educational or training purposes. But too often in medicine, we dehumanize patients, especially Black patients. Studies show that Black patients are still less likely to receive the same amount of pain medication, even for the same injuries as white patients. And alarmingly, some medical students still believe myths like that Black people have thicker skin, or that Black people have less nerve endings. That's why representation in medicine matters, why we need Black and brown medical students, residents, and physicians, so that we're not just in the room, but we're speaking up for our patients in these rooms. What happened in that OR wasn't a teaching moment, wasn't education, it was violence. And the only way we can stop it from happening is by naming it, challenging it, and transforming the culture of medicine from the inside out.